Our project is Maternal Health Matters with team members Omara Afzal and Jamila Hoy Rosas. The objective of this program was to understand the lived context of New York City's prenatal and postpartum patients and their community members. We want to translate our findings into education for healthcare providers and the community at large, and use this to provide support systems for OB patients during their pregnancy and postpartum period, including using digital health solutions to engage patients and improve care. How did this program come about? The United States has the highest rate of maternal deaths among developed countries, 60% of which are preventable with better access to prenatal and postpartum care and self-management of chronic diseases. The reasons for this are complex, including race and place disparities, which affect the maternal health outcomes. Recent studies have also attributed these disparities to a high burden of pre-existing chronic illnesses, chronic stress, and racial bias in healthcare. The postpartum period has also been recognized as a critical time period to improve women's healthcare. Yet postpartum visits are poorly attended and often lead to gaps in contraceptive care, mental health care, and continued care for chronic conditions. What does this program entail? We designed and are conducting qualitative inquiries, in-depth interviews with prenatal and postpartum women to understand their experiences of clinical care, social support, community resources, chronic conditions, and self-management. We will use these findings to educate healthcare providers as well as to perform outreach to community organizations to increase support. We have also designed a 6-week text messaging postpartum support program for pregnant women to provide educational, social, and logistical support. This is particularly important in the time of COVID when we may not be able to do as much one-on-one counseling. We are also using telehealth video visits for nutritional counseling and collaborating with local food pantries for monthly waiting room programming as well as other food support services. How did we do this? We started with a stakeholder analysis of local and regional maternal health programming and policies to see what is in place and what is lacking. This included a literature review and research planning with the New York State Task Force report review and review of epidemiological data from New York City of pertinent health outcomes. Using this and our interview data, we are able to do a community assets and resource mapping and further explore the barriers, needs, and assets of prenatal and postpartum women, their families, and their communities to aid in designing supportive measures with digital health solutions and beyond. The evaluation of this program is ongoing. We are evaluating both processes through staff reports, electronic medical records, the surveys and interviews that are performed, as well as hospital administration data, as well as an impact evaluation of the programs in place using electronic medical records and hospital administration data. What are the next steps? We'll continue the randomization of postpartum patients into the text messaging intervention and control groups to further study these digital health solutions as support programs. There's also ongoing program development informed by the community, including a community health worker program to coach patients through their pregnancy and postpartum period, which will be developed based on the results of our interviews. And we will be designing a toolkit for healthcare providers of patient support systems as informed by the interviews and data gathered. Thank you.